Warts are a common thing that I see that patients come in and complain about. Almost everybody has had a wart at least at one point during their life. So warts are caused by the human papillomavirus, also known as the HPV virus. Now it's typically not caused by the strains that people think about as far as cervical cancer goes, so that's an important thing to understand. And so warts are caused by this virus, which causes a thickening of the skin. And so what can happen is those can spread by direct contact from other people, or you can actually spread them on yourself if you have an injury and touch a wart to that injury. And so there's lots of different treatment options for patients with warts. And I customize my treatment plan for that particular patient based off of how old they are, how many warts they have. Lots of different factors play a role into that. So some of the most common treatment plans that I come up with for patients with warts is using liquid nitrogen. Now there is a little bit of pain up front with that. It causes irritation and blistering to the warts when we treat them, but usually does a good job. For patients who don't want to feel anything painful whenever we're treating them, we can use a blistering solution. It still causes blistering and irritation to the wart, but you're not going to have that pain up front. So that tends to work better for people who just either don't want pain or for younger children. For people with lots of warts, we may consider using different creams that are applied at home, or also we can do immunotherapy where we actually use the patient's own immune system to help attack and get rid of the virus that causes warts. Patients will come in and sometimes ask whether their warts need to be treated. For a majority of warts, they're just aesthetically discomfort or uncomfortable, or people just don't like the way that they look. And so for those people, warts technically don't have to be treated for the most part. There are exceptions. So warts typically will go away on their own within about 2 years. Your immune system will eventually recognize that virus and get rid of it, and your warts will go away. Now that can be unpredictable. I say 2 years, but sometimes it goes on for longer than that. The one big exception for leaving warts alone are genital warts. Those are warts that are found typically in the groin area. It's a sexually transmitted disease in most circumstances, and if you do have those, you should arrange an appointment with your provider to have those treated, as they can potentially lead to problems down the road. Most of my patients have already tried lots of different treatment options before they come in to see me for their warts. They could try blistering solutions, they try freeze away. There's lots of different things on the market that are described as being able to get rid of warts, but I find that most of them are ineffective. They may work whenever warts are really small or haven't really thickened up as much as a typical wart can potentially become, but most of them are not going to work. If they do work, like I said, it's because they're small and are causing just enough irritation for the body to recognize that virus and then clear the virus. But a majority of times I don't find that those are effective.